4 years ago, my little cousin Abigail came into the world. She was a normal, beautiful little baby at first. Then she started to get sick. After a series of tests, the doctors finally discovered that she had cystic fibrosis. You are probably wondering what this is. Cystic fibrosis is a hereditary disorder affecting the exocrine glands. It causes the overproduction of abnormally thick mucus, which leads to the blockages of the pancreatic ducts, the intestines, and the bronchi, and often results in respiratory infections. Today, about 30,000 men, women, and children are affected in the United States alone. The symptoms or identifying signs of cystic fibrosis include very salty tasting skin, persistent coughing, frequent lung infections, wheezing or shortness of breath, and poor growth or weight gain in spite of a very good appetite. Testing for cystic fibrosis that I know of are the sweat test, the newborn screening test, and the genetic carrier test. The sweat test is when doctors take a sample of the patient's sweat and measure the concentration of salt. A high salt level indicates that that person has cystic fibrosis. The newborn screening test is when newborns are tested for it. This early diagnosis can help add years to that person's life because they can begin treatment earlier. All states in the U.S. screen newborns for cystic fibrosis. And the last test is the genetic carrier test. More than 10 million Americans are symptomless carriers of cystic fibrosis. A simple blood test can determine if you are a carrier or not. To inherit this disease, both parents of the patient must be carriers of cystic fibrosis. Before today's medical advancements in research and medical treatments, few children lived to see their elementary school days. Now, many people with this disease can live well into their 30s, 40s, and beyond. There are many options for treatment, but lung transplant is the one often discussed. Lung transplants are given to patients who need them the most, and they must go through an evaluation process by their healthcare providers. The evaluation looks at if the transplant is necessary and at a time is needed. They look at how healthy the heart, lungs, and liver are. They also look at to see what infections or bacteria is in the body. They also look at the patient's support system because the people around them play a big role in their decisions. And they also look at their psychological well-being. Almost 1,700 lung transplants were performed in 2011 alone, and the number is still rising. The success rates of the lung transplants say that over 80% are still alive after 1 year, and over 50% are still alive after 5 years. This is a picture of what your lungs look like with cystic fibrosis and what they don't. This is a pair of lungs with cystic fibrosis, and you can see that it's blocked by mucus, and then over here is a picture of healthy lungs that have unblocked passages. It says, although this transplant can help, it doesn't cure cystic fibrosis. Patients still have CF in other parts of their body, and it can come back into their lungs. But getting the transplant can help expand their lives longer and make them happier. A person with cystic fibrosis can lead a normal life if they take their medication and do as their doctor says. And I hope I gave you a better understanding of cystic fibrosis, about the disease, and about the people who have it. I've got all my information from the website called Cystic Fibrosis Foundation. It is www.cff.org, and I got my picture from Google. And